leg here, we're going to start with the quadriceps. Actually, no, we'll start with the superficial muscles, the way we saw it in the cat. So as far as the superficial muscles of the thigh, we're looking at the sartorius, which would be one of the most superficial muscles, and then the gracilis, right there. So on the cat, remember the sartorius was huge, it covered the entire quadriceps group, and the gracilis was also a lot wider, it covered pretty much all the adductors. But in humans, they're a little bit thinner. As far as the actions, remember the sartorius is going to help flex the knee and then laterally rotate the thigh. For the gracilis, you're looking at knee flexion as well. So as this pulls, it's going to basically pull up from here and again allow you to flex that knee. As we go deep to those, we'll start with the lateral group of muscles here, the anterior aspect. This is your quadriceps group. So the visible muscles, initially you have the rectus femoris. Rectus femoris. Lateral to that, the vastus lateralis. And then the vastus medialis, medial to that. And if we go deep to the rectus femoris, you would see the vastus intermedius. These four, again, make up the quadriceps group. And their general functions are going to be to extend the knee and then to also flex the thigh at the hip. But if you have to remember one, remember knee extension. Knee extension for that guy. As you go deep to the gracilis, you have your adductors. So the main adductor that you're seeing here is the adductor longus. And then you would have your pectineus, which is slightly deeper to that. And then in humans, you also have the adductor magnus and brevis, which are a little bit deep to this. In any case, all of these are going to be involved in adducting the thigh. Remember in the cats, we had the adductor femoris as opposed to the adductor magnus, right? But again, the functions are the same, or the actions are the same. Here you also see the iliopsoas. Iliopsoas there. This guy is going to be involved in flexing the hip, or flexing the thigh at the hip as well. Right? So those are kind of the major muscles here. As we go towards the kind of more lateral, posterior lateral aspect, you do see the tensor fascia lata. Right? And here's the iliotibial tract, or the IT band. And so this particular muscle is going to be useful for extending the knee. Posterior to that, you have your glutes. Here's the gluteus maximus. And as you go deep to that, you'll see the medius and the minimus, deeper to that. In general, this whole group is going to be involved in abduction, right? Abducting the thigh, as well as extending the thigh at the hip. And again, think about climbing the stairs, right? These are the guys that would allow you to really extend that thigh. So those are the glutes. As we get to the posterior aspect, in the posterior aspect you have your hamstring group. The hamstring group is going to consist of 3 muscles. On the lateral aspect you have your biceps femoris, which is kind of the largest of the 3. And as you go to the medial aspect, superficially you're going to see the semitendinosus, and deep to that, the semimembranosus. So those 3 make up the hamstring group. As far as actions, think flexion of the knee, and then extension of the thigh at the hips. But again, if I had to remember one, flexing the knee for the hamstring group. As you go down to the crural region, here's your gastrocnemius. Right? Deep to the gastrocnemius, you would see the soleus. These are synergists for plantar flexion of the foot. So they're going to allow you to kind of point your toes out. As you come around this way, you see the peroneus longus, or the fibularis longus. This guy allows you to evert the foot and also to plantar flex to some degree. Anterior to that, you see the extensor digitorum. The name says it all here. This guy is going to allow you to dorsi extend the digits, and will be involved in dorsiflexion of the foot to some degree. But the main dorsiflexor of the foot is going to be the tibialis anterior. Tibialis anterior, right? This guy really allows you to dorsiflex that foot. And those are the major muscles there. Any questions?